Welcome to the Faculty of Nursing and Midwifery at the RCSI.
We are creating transformative CPD content
using state-of-the-art cutting-edge technology
developed by our experienced and dedicated teams of subject matter experts
to meet the continuous professional development needs
of nurses, midwives, and dedicated healthcare professionals just like you.
Thank you for joining us at the Faculty of Nursing and Midwifery for this CPD course on the care of adults with epilepsy. This course is designed to give you an overview of epilepsy. On completion of the course, you will be familiarized with a variety of conditions that fall under the umbrella term epilepsy. We'll review the various known causes of epilepsy and the treatment approaches that apply. We'll take a look at the prevalence of the condition in Ireland and the UK, and consider some of the factors driving the increase in numbers of cases. The focus of our CPD approach is patient-centered. As healthcare professionals, we play a critical role in providing care to patients with epilepsy. The course is structured to provide a foundation for you to build upon. To support this, we provide web links and a reading list so you can explore the topics further. As you go through the course, feel free to pause, rewind, and take notes. For those joining on the Flow MCPD platform, there is the option to complete a reflection via the app. Finally, you may want to take reflection notes for your e-portfolio. So, what is epilepsy? Epilepsy is a neurological disorder that affects the brain's electrical activity, leading to recurrent seizures. A seizure occurs when there is a sudden abnormal electrical discharge in the brain, leading to a disturbance in the normal brain functions. The symptoms of a seizure depend on the type of epilepsy and the area of the brain affected. The causes of epilepsy can vary depending on the type of epilepsy and the individual's medical history. Some common causes include genetic and inheritance factors, head injury or brain traumas that can lead to epilepsy. This is particularly the case if there is a skull fracture or bleeding in the brain. Another cause is tumors in the brain. Again, it very much depends on the location of infiltration. If tumors are located in the areas of the brain that control movement or sensation, this can cause epilepsy, as can strokes if they damage certain blood vessels. And finally, infections of the brain, such as meningitis, have been shown to cause epilepsy. Generalized epilepsy involves both sides of the brain and can cause convulsions, muscle spasms, and loss of consciousness. The most common type of generalized epilepsy is tonic-clonic seizures. Focal epilepsy affects only one part of the brain and can cause a wide range of symptoms including confusion, altered sensations, and involuntary movements. Absence epilepsy is most commonly seen in children and can cause brief episodes of staring and unresponsiveness. Myoclonic epilepsy causes sudden, brief muscle jerks that can affect one or both sides of the body. The causes of epilepsy can vary depending on the type of epilepsy and the individual's medical history. Some common causes include genetic and inheritance factors, head injury or brain traumas that can lead to epilepsy. This is particularly the case if there is a skull fracture or bleeding in the brain. Another cause is tumors in the brain. Again, it very much depends on the location of infiltration. If tumors are located in the areas of the brain that control movement or sensation, this can cause epilepsy, as can strokes if they damage certain blood vessels. And finally, infections of the brain, such as meningitis, have been shown to cause epilepsy. Moving on to prevalence in Ireland and the UK, numbers suggest that epilepsy affects an estimated 37,000 people in Ireland and around 600,000 people in the UK. The prevalence appears to be increasing in both countries, possibly due to an aging population and an increase in traumatic brain injuries. Additionally, advancements in medical technology have led to more accurate diagnosis, leading to an increase in reported cases. As a neurological disorder, epilepsy and its comorbidities can have a significant impact on a person's quality of life. That is why it is essential to have a clear understanding of the different types of epilepsy, their causes, and the prevalence of the condition so we can provide effective care to patients. Next, we'll take a look at treatment, management, medication, side effects, and emergency procedures.